Hello everyone, my name is Vinicius Montanaro. I'll be giving a lecture on the use of AI for predicting outcomes in pre-hospital stroke care. Artificial intelligence can be defined as the algorithm or a computer program that mimics the human intelligence in making decisions and thinking. The machine learning is a subtype of artificial intelligence in which the algorithm learns from the patterns in the variables that you insert in it. And we also know that the binomial human algorithm is usually superior to the human alone or algorithm alone, although there are some variations, especially when the human factor is not trained enough to use the technology in hand. Big data, which is a term that has been named from several decades now, is the amount of data that could not be analyzed via traditional statistical methods. It is very important to use artificial intelligence in those kinds of data that you can find a pattern and analyze it best. It is particularly useful in multicentric studies, the use of medical records, the precision medicine for the outcome for each patient, and also the Internet of Things, in which you use variables from several collectible devices, not only related to medical variables like your way of life, your television, your mobile, etc. In hospital data alone, 150 exabytes have been generated of data from 2011 to 2022. It is important to notice that we are in the fourth wave of the digital health, which includes precisely the big data, AI, the data analytics, and also the decentralized data collection from all variables, from all kinds of sources, like the Internet of Things that we said. It is also important to notice that we are currently in the peak of inflated expectations with the large language model algorithms being released, like the ChatGPT, Gemini, Copilot, etc. But eventually we will reach the plateau of productivity in which will be more ground-based and having the best results based on the reality of what the algorithm can actually do, and not have an hyper expectation that do not have basis on reality. Just very quickly, since we have little time, the types of AI can be divided in methods: in supervised, in which you give the label. For example, you want the AI to predict what is a cat. The unsupervised, which you do not give the label and the algorithm needs to figure out for himself what is the pattern inside the variables. It is very useful to divide in categories the variables and the data. Semi-supervised is very used in imaging, in which you give the label in the middle of the process. And reinforcement, when you give positive or negative reinforcement equations during the process of data analysis by AI. Therefore, artificial intelligence is divided in several subtypes. Machine learning is the one that we just saw. Deep learning is a specific type of machine learning in which we use neural networks, which is neurons. The generative AI is one that gives unique and individualized responses, and the large language model is a type of generative AI that mimics human language. So how can you use pre-hospital care? There are several uses. The pre-hospital recognition with smartphone and tablets given away early neurological signs like face asymmetry, weakness, the wearable devices alerting for cardiac arrhythmias, the emergency service dispatch for the warning of the emergency service for that a patient is coming with stroke to start the stroke protocol, the training of the emergency service personnel, also helping novel diagnosis like, for example, imaging, and also geolocalization like we will see in the following slides. For example, this is a classical publication in which algorithm based on deep learning evaluates the data inputted by someone who puts the data from the patient that is attended by the ambulance in the street or in house to say if the patient is having a stroke, to predict that outcome. And if so, the physician in the emergency department is alerted and the stroke protocol is begun immediately. Also, the classical apps that uses AI for image analysis can diagnose early, for example, an LVO or a brain hemorrhage, especially in those mobile units that has a CT in the ambulance, and the hospital will already know what to do based on intervention, and which hospital also will be probably the destiny of the patient that needs to make an intervention. This is interesting. There is some research being done, for example, with using geolocalization and Google Maps, for example, based not only on the patient itself, but also on the ways that he can go to the hospital, the emergency service, and the people in the ambulance can direct the patient to the correct hospital based on the needs of intervention. If it is a hemorrhagic stroke and it needs to surgery or a thrombectomy and LVO, and which hospital is closer, what is the best way, and also what is the insurance, for example, of the patient. That can be done and is being done currently in some research projects. Also, the wearables, as I said, can collect multimodal variables, not only those classical health records that we have. And also Fast AI, which is a very simple app that can be having on your cell phone, can detect early facial asymmetry. This is just a picture to illustrate that AI can be done in big data analytics since the financial analysis before the patient even get to pre-hospital care, all the way to the admittance of the patient in the hospital for assistance in decision making by the clinician. Of course, there are some limitations like data privacy, the reliability of a good internet, the biases that some algorithms can have, especially based on which population they study, and also the problem with equitable access. The more you specialize in technology, the more difficult it will be in some isolated places or poorer places to have the technology available to you. So with that, I end my lecture and thank you very much for all your attention. I'll be open for discussions. Thank you very much.